Hey there, this is Dr. Jeff Schmidt with Schmidt Facial Plastic Surgery, and I have a question today from an online poster who wants to know, how can I feminize my face after post-pregnancy facial volume loss? She goes on to say, after having major post-pregnancy facial volume loss, I had a fat transfer, 60 cc's, which is kind of a moderate to significant volume transfer, which helped a lot, but I still have issues. I'm 31 and healthy and wants to know, should I entertain buccal fat removal, cheek lift, chin filler, under eye filler? Please help me know what I need. It's like my cheeks are collapsing in toward the center of my face, which collapses my lips and gives me lines and folds. Jowls tend to run in my family. I've had big cheeks my entire life, and I want a V-line, heart-shaped face. So, great question, and I'm sorry to hear that your confidence is not quite where you want it to be following pregnancy. A lot of different things, and I do have some photographs here, but without talking to you and finding out specifically where you're bothered, it's a little bit tough to say. But what I'm seeing from the photographs is that there's a lot of heaviness in this kind of mid to lower cheek area, and I am noticing some heaviness in the fold areas, kind of both in the melolabial, or what some people call nasolabial folds, and then in the marionette lines here. At this age, it's maybe a little bit early for a lift. You may not see the results that you're really looking for, and I would say that if you're going to consider a surgical procedure, doing a little bit of facial contouring in the lower to midsection may help reduce some of the heaviness that you have in that area. You can do that using facial liposuction or buccal fat pad removal. That's going to help with some of the heaviness and fullness in this lower area, but it doesn't necessarily help with any sagging tissues or jowling per se. You can combine that with some volume, and it's really not about having volume or not having volume. It's making sure that you have volume in the right places and not having volume in the places where you don't want it. So you could remove some of that, and I wouldn't say to necessarily take that same fat and put it back in this area. You could always do a little bit more fat kind of up higher in the upper cheeks, which is where we typically want fat to achieve that aesthetic that you're looking for, or you could continue to use fillers, which of course in most cases are going to be more of a temporary solution. I hope that helps. I think that the best thing to do is to make sure that you're getting into a well-qualified physician, particularly a facial plastic surgeon that has a lot of experience in facial contouring. This has been Dr. Jeff Schmidt, wishing you health and happiness.